Welcome to the first part training series of the North Dakota Housing Information Training Series. My name is Heather Brandt. I work for the North Dakota Department of Health and Human Services with the Behavioral Health Division. We'll be covering topics today ranging from the North Dakota Continuum of Care, Housing Information System, some different housing assessments. We will also be hearing from one of our housing authorities in North Dakota, along with a local homeless coalition. So with that, I will let Chanel take it away and do her introduction.
Thanks, Heather. Can everybody see my screen? Heather, are we good?
Yes.
Perfect. Good afternoon. My name, like Heather said, is Chanel Willer, and I am the Continuum of Care Coordinator for the state of North Dakota. So I kind of was looking through the list of participants. I don't recognize a lot of names on here, so we're just going to talk about the overview of the Continuum of Care and our coordinated entry system, and then we'll talk about COC funding a little bit. So first things first, what is HUD? HUD stands for the U.S. Department of Housing and Urban Development, and they are responsible for most of the funding of housing programs across the United States. They do fund the Continuum of Care and also the Youth Homelessness Demonstration Program grants. What is the Continuum of Care? It's the COC is a HUD mandated program, actually, that's basically broken down into three sections. There's the interim rule, the program itself, and then planning. So the interim rule is the laws and rules for which COC funding and planning operates. The rules reflect the planning process, the definition of homelessness, how to obtain and use your COC program funds, and it outlines data collection and reporting that we are required to do as a continuum of care. The program itself is the homeless funds used to support individual homeless programs. COC funding can be used for the Homeless Management Information System, transitional housing, rapid rehousing. There's a joint transitional housing, rapid rehousing component, permanent supportive housing, which is broken down into two sections. Permanent housing is, it's permanent supportive housing, and then rapid rehousing is the other piece of permanent housing. And then the last one is supportive services only. And then finally, there's the COC planning. And that's a regional planning body that's focused on preventing and ending homelessness. This includes our membership, the planning group that meets on a quarterly basis to carry out the COC interim rule and manage our coordinated entry system. And then COC planning also incorporates both the interim rule and the COC program. We provide data on homeless trends and needs to anybody who requests it. And we really evaluate those projects that are receiving the grant to ensure that they are providing the best services and following best practices for the people that they serve. Who's involved or who specifically should be involved in the COC planning? Well, key partners that provide housing and services to persons who are homeless are essential to planning. The COC really welcomes anyone who has an interest in preventing and ending homelessness within our state. It is important to note that homeless programs alone cannot prevent and end homelessness. It does take a broad collaborative group with numerous funding sources and strategic partnerships. So funders, policymakers, advocates, housing and service providers, and persons with lived experience all contribute to ending homelessness. The COC planning brings all of these partners to the table to assure that there is a comprehensive, informed, and a coordinated approach to ending homelessness or preventing it. And currently, the North Dakota Continuum of Care has right around 180 members that represent about 80 agencies. So in the US, there are approximately 400 designated COCs. Each has their own leadership, their own governance structure, their own committees and work groups, their own coordinated entry system, policies, and funding. North Dakota is one of the few states that only has one COC to cover the entire state, and that includes all 53 counties that are broken down into 8 regions. Now, one unique thing in 2020 or 2021, HUD allowed us to start including tribal entities, so tribes, tribally designated housing entities, and they can receive funding from the COC now. However, we do have to have a signed resolution with the tribe to be able to include them within our geographic area. North Dakota, for the first time ever, we did get a signed resolution from Turtle Mountain Band of Chippewa this year. So they are eligible to apply for the funding competition that we'll have. We'll talk about that in a minute a little bit. So our organizational structure, as I talked about a few minutes ago, the COC structure is designed to include broad input from consumers at the sub-regional and local levels. So the membership is responsible for all the big stuff around COC planning, and that includes approving our policies, electing the COC board members, approving the ranking priority list that we submit to HUD for funding annually, and then also approving our homeless management information system lead agency and the collaborative applicant. The board is comprised of elected and appointed members, as well as non-voting advisory seats, and they're responsible for assuring COC compliance and guiding the work of the COC. Our board is made up of a representative from each of the 8 regions across the state. And then we have 3 at-large positions. So we have an at-large for an LGBTQIA+ person, someone with lived experience, which is mandated by HUD. And the third at-large that we have is Black, Indigenous, and people of color position. So that's our voting members. And then we do have representation from the North Dakota Coalition for Homeless People. Currently, the North Dakota Department of Commerce is a non-advisory seat. And then our HMIS lead agency is as well. Our COC currently has 5 standing committees. We have a data committee, system performance measures, CARES, which is our coordinated entry, and the CARES committee is a collaboration with the West Central Minnesota COC because of the cross-border that we have with Fargo and Moorhead. And then we have the rating and ranking committee and the youth action board. We can also appoint ad hoc committees or work groups as needed to accomplish any goals that we really feel we need to dig into and look into further for the continuum of care. And then there's the local homeless committees or coalitions. Those are the sub-regional partners that focus more on improving their system design through planning, evaluation, implementation at the local level. And so we try to participate as much as we possibly can in all of the coalition meetings across the state, just so that we know what's happening at that local level, but also so that we can share what's happening at the state level with the COC as well. The collaborative applicant is the fiscal agency that's responsible for the COC planning funds and submitting the COC consolidated application to HUD. So we have to do a local competition every year. HUD tells us how much money we have, and then we do a local competition where we actually have to rate and rank all of the applications, and we have a committee that takes care of that for us. So North Dakota Housing Finance Agency is the collaborative applicant for North Dakota, and that is where myself and Shanna Lindquist Segrist are based out of. So why is the continuum of care important? I want you to take a minute and think about healthcare, right? A continuum of care model in healthcare successfully manages and supports someone's medical care through a range of health services. And that's important because it leads to an improvement of health and potential reduction in costs for the patient. Well, it's the same with the continuum of care for homelessness. By working together with our providers in our area who are committed to ending homelessness, we can improve the process to quickly rehouse individuals and families experiencing homelessness, or even prevent them from becoming homeless. By enhancing this process and housing people as quickly as possible, it reduces trauma to the individual or family and provides a sense of stability for them. And then finally, data collection. The COC works with providers across the state on quality data that is submitted to HUD. So for example, the point in time count happens every year in January. It's the last Wednesday of January. Don't ask me why we have to do it that way, other than HUD tells us that's when we have to do it. We would prefer to not do winter because we would find more unsheltered individuals outside during the summer months, but HUD tells us we have to do it at that time of year, so that's when we do it. So that the housing inventory count and system performance measures are all submitted to HUD on an annual basis, and that helps determine the amount of funding that each COC receives. That's not the only thing that determines the funding, but it is a piece of it. So without that data, we can't get any funding, and without the funding, we really can't work together to end homelessness within our state. Okay, continuum of care funding.
I think that you just raised like a really important point that I want to continue to emphasize throughout throughout this series is really, two things: getting involved, understanding where, data entry points are and how to access those so that we have appropriate data for North Dakota, because oftentimes some of the barriers we hear, for example, we'll hear there's a lot of homeless people in this region, but there's no data to support that. And so when they're applying for funding, they can't get that secured. So as Chanel's presenting, Jana, Carrie, and the next one's talking through this data and data collection pieces, I kind of want you all to be strategically thinking where you should be integrated within those processes.
Thanks, Heather. So the COC funding components that can be covered, again, I mentioned this a little bit earlier, but I'll just go over them in a little more detail. The Homeless Management Information System, or HMIS, is the system that we use, and HUD requires us to use HMIS to collect that client level data on the delivery of housing services to program participants. Again, this system is mandated by HUD for all COC and ESG funded projects. Now, the North Dakota Homeless Grant also requires the use of HMIS. And this funding can be used to pay salaries for operating HMIS, staff training, staff transportation to conduct intake with clients, and the payment of fees charged by the HMIS lead agency. So for North Dakota, we have a pretty large grant that we award to Institute for Community Alliances for their staff people. And then we do award, they do also receive money from the Emergency Solutions Grant and from the North Dakota Homeless Grant. But an agency can also write HMIS into their application to cover all of those things that I just mentioned. Joint Transitional Rapid Rehousing was a new component that HUD added in 2017, and that provides a safe place for people to stay in the transitional housing, and that has the wraparound services and also financial assistance to determine. That's all determined by the client. It's all client choice. And then it's to help them move to permanent housing as quickly as possible. So that permanent housing, they'll stay in the transitional housing for a certain amount of time, and then they'll move into rapid rehousing, where there may be some financial assistance to help them establish their rent and get on their feet a little bit in their own place. But those wraparound services continue with them for another 2 years, up to 2 years, based on the client needs. Eligible costs of this include leasing of a structure or units and operating costs for the transitional housing, and then short or medium term rental assistance for clients for rapid rehousing. Again, supportive services. HMIS can always be written into any of these components. And then administrative costs also. So the agency can request, I believe it's 10% of administrative costs on any of these components. Transitional housing. So the goal of transitional housing is to provide stability and support to a household to then successfully move them to and maintain permanent housing. Under transitional housing, the project or the agency holds the lease on the units and the client does not. So YouthWorks, for example, has a transitional housing unit in Bismarck. They have an apartment building, they hold the lease on it, the clients stay in those units, and then they can actually pay. I know how YouthWorks has it set up is that the clients will pay like $30 a month, but that money literally goes into like a savings account for the client that they get back then when they move into their own unit. Supportive services are always provided in every single one of these components as well. So the supportive services only component includes conducting outreach to sheltered and unsheltered persons and families experiencing homelessness and providing referrals to other housing or necessary services. And then finally, permanent housing. On permanent housing, the client has to sign the lease. So now it's not the agency, it's the client that's actually signing the lease on the unit. It must have an initial term of at least 1 year and be renewable for a minimum term of 1 month and can only be terminable by cause or for cause. So there are 2 types of permanent housing. Permanent supportive housing includes supportive services to assist households where at least one member of the household has a disability to help them achieve housing stability. In most cases, permanent supportive housing must be for households that are chronically homeless. And then the second type is rapid rehousing, and that provides a shorter medium term, up to 3 months for short term is 0 to 3 months, and then that medium term can be anywhere up to 24 months of rental assistance. And again, supportive services should always be included in this, but that is based on what the client wants.
Chanel, we have a question in the chat from Josh asking, what are some examples of joint transitional rapid rehousing with the built-in supportive services and wraparound?
Yeah, so YouthWorks, I talked about a little bit. They have a really great program where they do the joint transitional rapid rehousing component. And so what they'll do is they'll take a youth that needs to be housed, they'll place them in one of those transitional housing units. They work with that client to help them find employment, really stabilize themselves. Maybe they have some education goals, so working with them to find ways to go to college or get their GED or finish high school if they need to, right? Because they're working with youth. So they'll work with them. They can be in that unit for up to 2 years. Once that 2 years is up, then they will work with them or previous. If I mean, I know some youth that are only in it for a year or a couple of months. So then YouthWorks will work with them to find their own apartment. And that's where the rapid rehousing comes into play, is that rental assistance for anywhere from 1 to 24 months of rental assistance. Now, I think YouthWorks usually does about 3 months of rental assistance, but that supportive services stays with that youth until up to 2 years. So if there's a youth that needs that full 2 years of supportive services, they are required by this funding to stay with them for the full 2 years. They don't have to. If the youth stabilizes and they're doing great on their own and they decide they don't need it anymore, then YouthWorks can close out that case. Does that answer your question, Josh? Heather, I can't see the chat.
I think so. Thank you, Chanel.
Okay.
Yep. That helps. Thank you, he says. Yep, appreciate it.
So who can get funded by the COC? Nonprofit organizations, state and local governments or instrumentalities of a local government, like I mentioned earlier, Indian tribes and tribally designated housing entities, And public housing agencies are all eligible for COC funding. So Indian tribes and tribally designated housing entities was new, like I said, in 2021. And we're just super excited to have gotten that tribal resolution this year with Turtle Mountain Band of Chippewa.
Is there any rapid rehousing for adults?
Yes.
I think
So
he was
on-
asking about the joint transitional, Chanel.
Sorry. Thank you,
okay.
Jenna.
Yeah.
Which
I don't
one?
think there is the joint transitional housing for adults.
There is at the YWCA in Fargo.
But that's primarily
but that's going
domestic
to be
violence.
domestic violence. Yeah. So you can see on this slide right here, this is the funding that we received in fiscal year 2021. Now, the unique thing about COC funding is the competition happened in 2021, but their funding didn't actually start until 2022. So the funding starts a year after the competition, basically. Each year there are opportunities for new projects to apply through a reallocation process of renewal projects, and we do get bonus funding. Now, that doesn't always mean that HUD will award the bonus funding. For the past couple of years, HUD has had domestic violence bonus funding, and a lot of it depends on how we score in the overall competition with all the other COCs. And we have to rate and rank projects in tier 1 and tier 2. And so tier 1 is typically our annual renewal demand. And so the only way to really gain a new project a lot of times is to reallocate funds from another project. We did do that this past year in the fall of 2022. We reallocated a couple of projects and got a new project for Grand Forks Housing Authority. Now, they're not listed on here because their funding hasn't started yet, but HUD did award their full amount. The projects that we had in tier 2, we split some projects to potentially cut some funding from some agencies that were underperforming a little bit. And then we put our DV bonus in tier 2 and we didn't get that. So new strategy for next year on figuring out how to place a DV project in tier 1 instead. So these are the agencies right now. We've got a total of 2.1 million coming into the state. And that's where we're at with that. And then we also have the Youth Homelessness Demonstration Program. So in 2017 and 2019, North Dakota did apply for the Youth Homelessness Demonstration Program, and they were not awarded. In 2021, we decided to try again. So we applied for YHDP, and we were awarded there were about 100 communities that applied, and we were one of the 33 that were picked. So it's been a lot of work, but we're glad to have that additional funding. This grant is a coordinated community approach to preventing and ending youth homelessness. And so there's a few things that we had to do, requirements by HUD for this grant once we received it. First, we had to work with a wide variety of stakeholders across the state, including youth providers, housing providers, child welfare agencies, school districts, higher education, workforce development organizations, and the juvenile justice system were just some of them. So what we did was we held listening sessions across the state with all of these stakeholders to get feedback on what the gaps were that we needed to fill with the funds. At the same time, we were doing an assessment of needs for special populations for youth that are at higher risk of experiencing homelessness. That included BIPOC, Black, Indigenous, and people of color, LGBTQIA+ youth, parenting and pregnant, and then also youth involved with foster care and the juvenile justice system. We then had to take all of that information and put it into a coordinated community plan. And so we developed that coordinated community plan with a group of really great people and youth were all involved to get that submitted to HUD. So we got that all submitted and HUD approved it. And then we were able to go out and do an RFP process. Now, the one unique thing about YHDP is that while we still have specific components we have to stick to based on HUD's requirements, we can be a little more innovative with projects and test some new approaches to end youth homelessness. So one project that we awarded was to the Grand Forks Housing Authority, and they have 2 staff people, one at the public school, Grand Forks Public Schools, and another person at University of North Dakota working with the TRIO program. And so we're really interested to see what kind of data we can collect from that project just to work within schools and then see if we can't roll that out into other school districts in the state, some kind of project that would be similar to that. Another project that was funded is, the agency is based out of Minot, but they are actually doing outreach and supportive services in Williston and Devil's Lake are their 2 main focuses right now, but they're going to be reaching out to those more rural areas just because we know that there's a lack of services there. And so they're going to be doing some work in the more rural areas. And then YouthWorks was actually able to open a joint transitional housing, rapid rehousing unit in Minot. So they have 6 units now where they are doing that joint transitional rapid rehousing component up here. And then finally, the other thing that we needed to do was create a youth action board. And the YAB really has been the driving force behind many of these decisions of this grant. They were a huge part of developing our coordinated community plan, and they approved it all before we submitted it to HUD. They were also a part of the rating and ranking process. And so they reviewed all of the applications that were submitted. They held interviews with each of the agencies that submitted applications, and then they made the final decisions on who was going to be funded and what projects would be funded with that. Yeah, members have to be between the ages of 14 to 24. That is something that our Youth Action Board set. And then they do have to have lived experience of homelessness or housing instability. Now that can be through because of juvenile justice or foster care. It can be because of discrimination, because of LGBTQIA+. Maybe they got kicked out of their house because their parents don't agree. And said, not in my house. So really any sort of lived experience with homelessness or any housing instability. The last thing our continuum of care did was we approved 2 seats on the COC board for YAB members to ensure that they have a voice not only with YHDP, but also for the overall continuum of care. And then these are the agencies that were funded through YHDP. The planning grant is a one-time grant, so we will no longer receive that funding once those funds are depleted. The rest of these grants will actually roll over to the normal COC competition once the 2-year period has ended. So a little bit ago, you saw that 2.9 million, 2.1 million that we get for COC funding. Well, it's 2 million because it's a 2-year grant. So essentially we'll add another $1 million into our local COC once that 2 years is up. So it brought in an extra $1 million. Now I did make a commitment to our youth that we would continue to fund these youth programs and to continue to use that $1 million for youth specific programs. Okay. Heather, I am really going over here. So I'll try to get through the coordinated access referral and evaluation system quickly.
I think you're doing just fine. So yes,
okay.
Yep.
Okay. So previously I talked about the continuum of care and how providers who are committed to ending homelessness can improve the process to quickly rehouse individuals and families experiencing homelessness or even prevent them from becoming homeless. And the coordinated entry system is how we accomplish that goal. We are mandated by HUD to have a coordinated entry system for various funding streams. That includes the continuum of care. It includes.
You muted, Chanel.
I don't even know how I muted it. My button wasn't even anywhere near it. Anyway, so various funding sources are mandated to use coordinated entry. Coordinated entry streamlines access and referrals to services and housing opportunities with designated access and assessment sites. It ensures fair and equal access through standardized assessment tools. It incorporates a housing first approach with low barrier access, comprehensive referrals, and prioritization. And it's also transparent and person-centered and includes emergency access and safety planning. Coordinated entry also prioritizes assistance to those with the most severe service needs. And that's important because we have limited resources in our state, and we need to make sure that individuals and families that have the highest needs are prioritized first. So there's 3 stages to CARES. There's access, assessment, and stabilization. So the access stage is designed to help make homelessness rare and brief through well-advertised and coordinated access points and tools, as well as focusing on ways to resolve a housing crisis to prevent entry into the homeless response system. The tool that we use for this is the housing crisis triage. We are in the process of finalizing this tool, so we're not quite using it yet, but we're almost there. The assessment stage is designed to keep homelessness brief and one time through a comprehensive and unbiased assessment of a person's history, their needs and desires, and by prioritizing and matching households through a thoughtful and standardized process. Assessment matches the unique needs of clients to unique program services. And the tool we use for this is the housing prioritization tool. It was formerly the VI SPDAT. And then the stabilization stage is really just intended to increase the likelihood that homelessness is a one-time incident. So persons are stabilized in permanent housing and don't cycle back into homelessness. And this is where those supportive services really become important. The tool that we use for this is the Service Prioritization Decision Assistance Tool, or the SPDAT. All of these outcomes are measured through our system performance measures, and that includes reducing the number of new individuals homeless, reducing the length of time homelessness occurs, reducing returns to homelessness, and then increasing earned and unearned income, increasing housing stability, and reducing the number of persons who are experiencing homelessness. So in an ideal world, this is the way coordinated entry would flow if we had all resources available all across the state. So first, people in a housing crisis may present at or be referred to any of the CARES access sites. The access site would take them through the housing crisis triage to determine how a person progresses through our system. So persons with greater personal strengths and resources and few barriers would be diverted to community and mainstream resources for a self-guided resolution. Persons who are in housing and could prevent their homelessness or rapidly be rehoused with a single month's rent or deposit are prioritized for prevention assistance. And then persons who are unsheltered, fleeing violence, or at imminent risk of homelessness with no other place to go will be prioritized and linked to shelter, including emergency shelter, hotel or motel vouchers, church sheltering, or domestic violence shelter. Persons whose housing crisis cannot be resolved through either self-guided or assisted problem solving with any one of those previously mentioned resources are then referred for an assessment. So the assessment is the second stage. Housing housing assessors conduct an assessment. That's that housing prioritization tool. And assessments help identify client eligibility, choice, and what level of housing support is most appropriate for each household. The third stage is housing prioritization, and that's used to fill homeless dedicated programs as rapidly and appropriately as possible, assuring that households with current greatest needs are housed first. Those with the high need are going to be referred more to permanent supportive housing. Those with a moderate need are going to be that transitional housing or rapid rehousing. And then those with the low need are going to be more of the mainstream and prevention type resources. And then the final stage is stabilization. So stabilization services, sorry, I have this recorded, and it's moving by itself. So those stabilization services really, again, they can initially start before the household is even housed, and they'll help with the housing search or move-in readiness. That includes finding household furniture or supplies, and then using that SPDAT and various housing plans to help the family stay stable in their housing. So that's coordinated entry at a really high level. These next slides are the COC partners that we currently have. I won't talk about each one of them, but the ones that are bolded, they are the agencies that are assessment sites for their region. So in Region 1, we do not have an assessment site. However, I do believe Community Options is working on that. Region 2 has Project B and YouthWorks. Region 3 has the Lake Region Shelter. Region 4 has the Community Violence Intervention Center. Now that is only for domestic violence. Northlands Rescue Mission, Red River Valley Community Action, Spectra Health, and United Way of Grand Forks, East Grand Forks and area can all do that assessment within Region 4. Region 5 has the Cass County Sheriff's Office. That's mostly going to be for people that are coming out of prison. The Fargo VA Healthcare System, veterans only. Fraser Limited is youth only. Gladys Ray, Native Inc., New Life Center, Southeast Human Service Center, Southeastern North Dakota Community Action or SENCA, YouthWorks, and YWCA Cass Clay. YouthWorks in all of the regions are youth only. YWCA Cass Clay is also domestic violence only. In Region 6, we have Community Options and not the South Central Homeless Coalition. It should be the South Central Human Service Center. That is also an assessment site. In Region 7 in Bismarck, we have the Abused Adult Resource Center, Ministry on the Margins, Missouri Slope Area Wide United Way, Native Inc., the Salvation Army, and again, YouthWorks for youth only. And then in Region 8 in Dickinson, we have the Domestic Violence and Rape Crisis Center, and that's going to be domestic violence only also. And then Dillon's Crossing.
So Chanel, I don't know if Carrie or Jana are going to talk about this, but like if somebody's sitting here and going like, well, how do we become that? Like how can our agency be listed on here? How can we become that access site?
So it's all about, you're not required to join the COC to be an assessment site, but I would highly recommend it. Carrie and Janae can talk about it a little bit more, but to get into HMIS, your supervisor would need to submit a request to ICA through their website for a new user. And then it would be signing the CARES CARES partnership agreement as to what type of site that you want to be. So that access site, assessment site, a housing provider, and then Carrie or somebody within their team would take you through the training for HMIS.
And like Chanel said, you can find all that information on our website.
And I'm done. So I can answer questions or we can move on.
Great. Well, if there's no questions, we are going to be moving forward with some more information on HMIS. I believe that's Jana and Carrie. So I don't know who's going to be sharing their screen, but whichever of you want to start, please do.
You're muted, Janae.
All right. Well, that's the first thing I
There
need to
you
do.
are.
Okay. I'm going to share my screen. Let me make sure I'm sharing the right one. Okay. Can you guys see my PowerPoint?
We can. Thank you.
I'll be on
Okay.
the other end for any chat questions.
Okay, so let me just do an introduction of myself. My name is Janae Gray. I'm the HMIS director for North Dakota. I've worked for Institute for Community Alliance for a little over 5 years, and I've been in this position about 2.5 years. So we're going to talk about HMIS like on a higher level, and not digging into the details. But if you do have like questions about the details, like how do I sign up to be an access site, or anything like that, like Carrie said, put it in the chat and we can answer those questions. So I have been working in this field of data for quite a while, and I always say that data tells our story. You cannot look at a project, a program, a funding source without looking how that project, program, funding source is doing with the funds that they provide for our clients, right? So we have to have data to be able to evaluate things. And so that's where HMIS comes into play. So HMIS is the Homeless Management Information System. We use a software called Community Services here in North Dakota. We serve the entire COC in North Dakota, and the Homeless Management Information System allows agencies and service providers to see that aggregate data on a client level, right? It's local information that's provided that provides the information on housing services and individuals experiencing homelessness or at risk. And then the HMIS is used by agencies and projects across the North Dakota COC, and they collect different information on the clients that they serve. And we'll get in a little bit more detail about what that data is collecting. So HMIS gives you an opportunity to see the picture of what homelessness looks like in your community. And one question we did have in the chat, I just wanted to cover briefly, is how, can I enter data into HMIS if I am a non-funded agency? And HMIS is open. We do have a user fee that is applied for each user. But if you are providing services to people that are experiencing homelessness or at risk of experiencing homelessness, we also need that data, right? Even if you're not receiving the funding, because we want to be able to tell the whole story of the community. And if you're providing that service, we're missing a part of it. So absolutely. And if you have questions, you can reach out. I know Carrie put her information in there in the chat. What is an HMIS lead? So you'll hear that, you heard that in Chanel's presentation, and you'll hear that throughout this presentation. So I wanted to just briefly kind of go over what the HMIS lead is, what our role is, a little bit about ICA, and then a little bit of a history about the Homeless Management Information System on a federal level. So the HMIS lead is a designated applicant by the COC. So we go through the same NOFO process that Chanel was talking about with rank and review. We do get a really good amount of money from North Dakota through the COC grant, and we are thankful for that opportunity because that hasn't always been the case. Carrie can contest to that. Chanel can contest to that. So we've really built up the funding for HMIS in North Dakota, and a lot of kudos just go to Chanel for that, because it always works better. And I can tell you this, I've worked in 11 different COCs. It always works better when the COC and the HMIS lead are partners working together, right? Because the COC has to have an HMIS lead, and you can't have an HMIS lead without a COC. And so we work together in managing that data, and that is all in the COC interim rule that HUD provides to us. So this is just a little snapshot, and I'm sure Carrie probably looks at this and says, oh my gosh, I do so much more than this. And she does, and our team does. But these are just a couple little bullet points of like what the HMIS lead agency role is. And so we do all the day-to-day functions. So the help desk, we do training, we have a learning management information system that we are working on completely rolling out. We develop the HMIS local policies for the COC. All of that has to be approved by the executive committee and then the COC membership in North Dakota. But we work on developing those, keeping those up to date according to what HUD says that we have to have in those. And HMIS is taking information from the most vulnerable clients that we serve, right? And so we want to make sure that we're protecting their privacy and their dignity. So we want to make sure that the policies and the security plans reflect that also. So we also, get user agreements. We develop those agency agreements, things like that. We monitor, or we call it like technical assistance, to make sure that everybody's in compliance with the HMIS standards.
Janae, I'm going to
yeah.
stop you. You froze. So if you're advancing
Oh.
those slides,
Where am I at?
you're on what is the HMIS lead.
Okay, this is it. Is this good?
Yep.
Okay, sorry. I have one thing on one screen and one thing on the other screen, so I should probably change it. Just stop me again if I do that. I will say a funny story. One time I forgot to share my entire PowerPoint in a presentation. So I'm glad you stopped me. So we do the monitoring, the technical assistance, the compliances around what the HMIS standards are. And those standards, again, are initiated by HUD. And so we follow the information that we receive from the federal government. And then we administrate the software. So like I said, we use a software called Community Services in North Dakota, WellSky. They've gone through some name changes over the years, but we monitor that contract and we work with that vendor to make sure that everything is in accordance to what the COC needs from that software. And then we also work with them for the contract, but we also work for them with any bugs, things like that. So the COC doesn't have to do that, and users don't work directly with the software. They work through us, and then we try to get those issues resolved as soon as possible. Okay, so let's talk a little bit about Institute for Community Alliances. So as Chanel said, we have been selected to be the HMIS lead in North Dakota. We've been the official lead. Carrie and I went back and forth on this, but we think it's 2018 because it is a little bit confusing in North Dakota because we came in as a technical assistant and then we became the HMIS lead. So around 2018, we were the official HMIS lead for North Dakota. Last year was the first year that since we've been the lead, that we got funded through the COC for our services. And then like Chanel said, we do get ESG and DHG funding. We get some YHDP funding since they enter data into HMIS. So what HUD says and what these federal partners say is that there is a percentage of those funds that can be designated to HMIS since they are working with the agencies to collect that data that HUD needs. So so ICA is the HMIS lead in 35 continuum of cares across the country, and we're currently in 16 states. The North Dakota team itself is Carrie, who is on the call. Carrie's been here for 5 years. She is the system administrator, but way more than that. She does training, help desk. She works a lot one-on-one with agencies. She's our veteran staff in North Dakota. Michael Tonerali is the HMIS manager. He has newer in his role. He started December 1st. He worked for 7 years as a PATH coordinated case manager. And then he's worked 7 years for ICA. He came from the Missouri implementation. And then Christina is been here a little bit over a year, and she's also a system administrator. She works a lot with the data quality side of things. She's been leading our PIT and HIC effort, which we'll talk a little bit about in a moment. And then we have Alex. Alex is our report person, and we're really excited to be able to pull some reporting into North Dakota because that's one thing that we haven't had the ability to do. Other than the federal report. So look at things more in a COC level and project level data sets. And so Alex is, he's been here a little bit over a year. So the North Dakota team itself has about 30 years of experience in HMIS and HUD together, but the ICA, so the BIG, what I call it, ICA, has over 200 years of experience. So what's really neat about working for the Institute for Community Alliance and being an HMIS lead in COCs is that if North Dakota is struggling with something and Chanel calls and says, hey, do you know anything about this? I can pull my knowledge from working with other COCs or, you know, as the HMIS lead, or, you know, call another COC within our big ICA and help get that information. So ICA is based out of Iowa, and all of the 123 staff that are employed by ICA are all over the country. Like I said, a lot of people work remote now after COVID. Okay, so why is HMIS important? So I also understand when you're talking about a software and entering data that sometimes people think it's one more thing, and it is one more thing. You guys do, you know, hard things. I was at a conference, just a couple weeks ago, and somebody got up and they were doing a presentation and they said, case managers are not okay right now. And I just really felt that because it's like we always are asking more and more. And so I totally get that. Our team gets that. But HMIS is so important. And it's not only because it's required, but it informs those national policies. I'll say right now, that the administration had put out their 2-year plan or 5-year plan on how to combat homelessness, not only in cities, but also in rural areas. And their concentration is really on that prevention. So we need to have prevention data to see if prevention is actually working to be able to inform those policies, right? It also informs local planning, right? So what if you have a high number of unsheltered people in Minot, but you don't have a shelter in Minot? So let's look at those unsheltered numbers and see if we can get funding for shelter. Like I said, it's required. And then Chanel talked a little bit about coordinated entry at the end, and coordinated entry is so much more about, you know, it's about housing the most vulnerable people in your COC. And what HMIS does is all of that great information that Chanel says is we put it in the system, and then we can be able to pull that information out and actually refer people to housing. And so that's just a little bit of why HMIS is important. So this is just a little bit of history. I don't want to bore you guys, but I always think it's really good to see like where things come from, right? And so HMIS is one of the very first databases, our very first idea from the federal government to collect data. So I've worked in other nonprofits. I worked with other funding sources, and they have only been collecting data, say, for 10 years, where homeless services across the country or HUD providers have been collecting data since about 2001. So in the late 80s, 90s, this grassroots effort came together and was like, we have to understand what homelessness looks like, not only on a federal and state level, but at our local level. So those communities banded together and started to look at a new software through a joint RFP, a request for proposal. And it was published by NHSDC, which is still it's a nonprofit separate that does a lot of work with HMIS, HUD, things like that. They have a conference every year. But so they came together and put this joint RFP together, and the effort grew and it got the attention of Congress. So from there, in 2001, the Congress got its stuff together, right? So the early 90s or late 80s, early 90s, it took a little bit, but they got their stuff together and they started looking through the efforts of the McKinney-Vento Act programs, and they started looking to see what data do they need to analyze. Well, they know they need to develop something that's going to get unduplicated, client served at the local level and beyond. They wanted to analyze the patterns that are used of people entering and exiting that homeless services. So, why are people entering in, or where they're entering at, and then where are they exiting to, and then evaluate the effectiveness of the system, right? So I always say, if you're funding a program that gets, say $100,000, we'll just act like that's a lot of money, and they are providing services to clients, and their number one goal is to get people housed, but they're not able to get people housed, and they're staying in their program for case management, but they never have a move-in date to permanent supportive housing. When we evaluate that is, well, why aren't you able to do that? Is it lack of resources, lack of housing in your community? Is it lack of funding? You need more funding. So it's looking at and evaluating all of that together to see what the effectiveness is. So the HMIS became eligible under the 2020 or 2001, Supernova. NOFA. It was NOFA. It changed to NOFO this year. Now I can't say NOFA, but it's NOFO. Okay, so these are just some participating programs. Chanel went through this in her slide too. So all of these programs are required to enter data into HMIS. And so you have all your federal programs, which are HUD programs from the COC, ESG, HOPWA, YHDP, PATH. Then you have like the Runaway Homeless Youth Program. They have to participate. I'm going to just pause for just a moment. They have to participate in HMIS or an HMIS comparable database. So we're not going to go into the comparable database conversation, but if they are certain funding sources, they go into a liked HMIS system that protects their identity. And so then we have the SSVF stuff in there, and then we have some state funding, right? We have the NHD, or the North Dakota Homeless Grant, that's also recorded.
Danae's frozen. I think she might need to turn off her camera.
Can you hear me? Hello?
Yes,
Hello?
we can hear you now.
You know what? I think my thing did just what Chanel did. It like paused me, like muted me. Where did you lose me at?
You were just talking about the NDHD, the people that are entering in HMIS. Yeah.
Okay. So if it does that again, I can turn off the incoming cameras too. Am I cutting out at all, Heather?
It might be a benefit to turn your camera off. We can't really see you anyway.
Okay. and we probably have funny faces. Okay, and I'm going to actually turn off the incoming. Also, just give me 1 minute. And then the other thing I was going to say too is that the local funding can also enter information to HMIS, like I said before, as long as they're serving or preventing or doing prevention services for people experiencing or could be experiencing homelessness. So now we're going to just talk about our next few slides of like what data is collected. So universal data.
Janae, I have a
Yeah.
question. So
Yes,
like,
absolutely.
who would be entering this data? Why would they be entering this data? And how is this related to what Chanel discussed?
So the universal data elements and why they would be entering this data into HMIS.
Yes. Yep.
So
Like who would be entering this data and like what for? And like besides receiving, like you talked about those people that receive that funding that requires HMIS. So if you receive that funding, you likely know that you have to collect
Yeah.
the data in HMIS. So like who else would be entering this data? An assessment site or access
Yes.
site?
So yeah, anybody that would be doing coordinated entry, and we have some program specific data elements we'll get to in a minute. And I mean, anybody that's receiving any of the funding from the previous slide, right, would be entering this data in the HMIS. The UDEs on this slide are required for any project that is entering data into HMIS. So if you receive,
UDE, what's that?
yeah, the universal data elements. So
Okay.
so the universal data elements are the name, social security number, race, ethnicity, gender, veteran status. That has to be recorded by any federal project, okay? That is required by HUD. I will say this is that HUD does review the data elements, the UDEs for review every 2 years to see if things need to change. Last 2 years ago, the gender changed to have more options. This year is a year of review, and there are going to be some changes to the race, ethnicity. And then the social security number is always a point of hardship sometimes to collect that information from clients. And so what HUD has proposed to do is only get the last four of the social security number, since that would be maybe easier to get the information. So if you're receiving any of the federal funds, you would be getting you would be entering those UDEs into HMIS. Now, that data is then collectively reviewed to see what homelessness looks like in the COC. And then you have universal data elements for just project state elements where you're going to be looking at. So if you have, you're going to look at the disability condition, you're going to look at the start and end date of the program. So when they are enrolled in, say, I'm just gonna say emergency shelter and where they ended. So how long did they stay at the shelter? What was their destination when they left? Did they just disappear and their destination was unknown? Or did they exit to stay with friends and family? So we want to know where they're going after they leave the shelter, because that could tell us some valuable information, or tell the COC some valuable information. And then you're looking at the relationship to head of households. So are you housing families? Are you housing single individuals? The client location, the move-in date, if that is a rapid rehousing project, permanent supportive housing project, like when did they get into those projects? And then where were they prior to enrollment? So the project state elements are based on what project that you are participating in. So if you're an emergency shelter or permanent supportive housing project or housing prevention project, you are going to enter different data elements. But these data elements collectively is something that you would be entering.
So if you decide as a provider to start becoming an access site or an assessment site, what happens is Carrie comes and does training with you on all of this stuff that
Yeah.
Janae just talked about. So you don't, this is a little overwhelming, but yeah, it can feel like a lot, but Carrie does really detailed training and technical assistance if your agency decides that you want to start participating.
And then too, the COC does some really good training of like just the program stuff of coordinated entry. And so collectively, this is a little bit overwhelming of the data that has to be we ask to be recorded. I agree with that. But we are, like Heather said, we do training. We have stuff in the learning management information system that you can look at again, right? Sometimes if you need to go back and look stuff, we have a lot of knowledge base articles, things like that. So I'm not going to go into too much detail about the program data elements, but this is just some additional information that may be collected from the COC. This has some coordinated entry data points, some street outreach data points in this. And so all this would be gone over in training. The next thing is who uses this data. So after talking about all that information, right, we're gathering this data from our projects that we're entering into HMIS. So who uses this? So federal, state, local funding sources use this data. Monitoring compliance can use this data, like holding agencies accountable for the funds that they receive in their grant agreement. It's an evaluation to really see if your services and your projects are working over time. And then to see if you're really, to see, over time, how many people you're serving, where they're going, where do you need additional funding at, where you need to apply for reallocation. So it all goes all together to make sure that we're providing services that are really effective into ending homelessness. So who is listening? We get constant data requests that we go through the COC for approval, and I'm sure that they even get more requests, but we get a lot of requests from city and county officials in, North Dakota COC and other COCs. The state legislator, they get a report every year that was put together with data points of what it looks like in North Dakota. The governor, federal funders, and private funders, people are looking at data to see how effective we are serving people. And then a couple more slides. This is the federal reporting that is required that also is one of those points of responsibility for the HMIS lead. And so we do an annual performance report. We do a consolidated annual performance report. We do look at the system performance measures that goes to HUD, and that is one of the things that the COC, when Chanel was talking about that NOFO process, one thing that the COC is scored on is the system performance measures, which is really evaluating the entire system to see how we're doing in measures. There's 6 measures that they look at: length of homelessness, exits from homelessness, retention of housing, are some of the measures that they look at. The longitude system analysis, the LSA, and Carrie should be very proud I said that correctly. It is the newest report HUD is requiring, and what it does is it takes all of the inflow outflow information from the system and it puts it into a community database where you can really look at information. The database is already built, so you can look at over time who you're serving, where you're serving them at, and how long they're staying in those services. So it's a high level information, but it's already developed. And so we work on that report every year to submit to HUD, and it all comes out of the HMIS, the Homeless Management Information System. The point in time count, like Chanel said, is done the last week of January. We help with the shelters. Well, we do the shelter side of things and get that information. And then we coordinate with the COC and help some with the unsheltered by providing a tool so we can get that and then enter that information in to the HUD database, along with the housing inventory chart, which that just shows the number of beds and types of beds that are available on that night. So how many rapid rehousing beds, how many permanent supportive housing beds and such that you would have in your COC. And then we do, these are program uploads that we use for HMIS. So we do have some additional dashboards that we have. We have the point in time and housing inventory chart dashboard from the previous years. We'll have this year's uploaded as soon as we submit to HUD. We have a system performance measure dashboard on our main ICA site. So there are some, and we have the demographic dashboard too for North Dakota that we put together. So there are some dashboards on our website if you're interested in looking at more data. And then just to end, talking about all of these numbers and telling our stories, just remember that every data point is someone. And so it's not just looking at the data, it's looking at the data and the story behind it and how can we make it better for the people that we serve. So I am done. Does anybody have any questions? And I know that was a lot.
So just briefly, just wanted to tie a couple things together for you all. Thank you for that, Janae. Chanel really presented on like the continuum of care and talked, briefly about being an access site or the completing those assessments, and just really to make those dots for you. HMIS is to connect those dots. Is if you don't have access to HMIS, you can't be an access site. You can't complete those assessments. And when your agency or you as a provider is making contact with individuals experiencing homelessness or at risk of homelessness, and you can't find those resources within your community to get them put into HMIS, that's really where we start to see issues, and we do have lack of those sites. Would you guys concur with that? Chanel, Carrie?
Yes, definitely.
Mhm.
One thing I put in the chat is the data that comes out of HMIS is it only shows a picture of homelessness for those that are participating in the database. So one of the big things that we see a lot of when we're doing the data analysis is that Western North Dakota looks like we're not experiencing homelessness or those that are at risk of homelessness. So, the question is it solved? And if they did, great. Let's find out, what they're doing for the solution. But if they have it, then we need to see that data so that we can help you and get those resources to really get that true big picture. Because we can only get a good representation if we actually have the data.
Thank you so much. With that, I know that, we've kind of been we've been going for a while now. Many of you are probably at the point where you need to take a break. Please just step away, take a break whenever you need to. But with that, I would like to welcome Katie Joe. Katie Joe is with the Grand Forks Housing Authority, and she's going to be doing her best job to do a presentation on kind of the role of the housing authorities in all of what we've been presenting. And then following her presentation will be Kayla and Jenna talking about their local homeless coalition and kind of the role of that coalition. So with that, Katie Joe.
Sounds good. Hey, everybody. I am going to turn my camera off because Teams is also not my best friend and I don't want to lose connection. So I'll turn that off, and then can you let me know if my presentation goes?
We will do that.
Are you able to see?
We can see your screen now, but your entire show. So once you start it, then we should be able to see it slide by slide.
Hmm,
So if you just want to do slideshow start,
So I did.
then just change the screen you're sharing. Up on the top, I think it says presenter view, or can't remember. Hold on.
Maybe we'll try it this way. Nope.
No, we can still see like the entire other screen.
That's rude.
I can share the screen for you, Katie Jo, and you just have to tell me when to click. So just a moment here. I will do that. So you guys don't have
Like
to.
monitors, you think that'd be beneficial, but I guess not.
It does make it a little bit weird sometimes. Just one moment. Okay. Okay, I'll be sharing my screen here. Okay. I think at the top it says display settings. That's what you have to click on, but I can do it here quick. I'll take it from you. Okay.
Okay.
There you go.
Thank you, dear. All right, so hey guys, yep, I'm Katie Jo Armbrust. I work at the Grand Forks Housing Authority. I'm the project director for a SAMHSA grant. SAMHSA grant is a federal substance abuse mental health service agency. TIH means treatment for individuals experiencing homelessness. These are funds that help support service providers that work with individuals who are in the community that either have experienced homelessness or are at risk of homelessness, that have a behavioral health condition. All of that to say, I'm not your typical housing authority employee. I've worked at the Grand Forks Housing Authority for over 12 years with a variety of positions, whether it be first-time homeownership with the Grand Forks Community Land Trust to helping develop LaGrave on First. But I am not a property manager or voucher administrator. I don't have the honor of directly assisting people into affordable housing, but I can try to answer questions as best as possible. So yes, so background, I feel like it's important to take a step back and think about why housing authorities even exist. So briefly, there have been different forms of housing assistance for a long time in our country. There have been a couple of bills that were passed, and most notably, or not most notably, but notably, the Department of Housing and Urban Development Act of 1965 was a bit of a game changer, and HUD was now a cabinet level agency, which meant housing was at the table with the president and in discussion with how housing affects everybody in day-to-day life and how it affects our country economically. So following that, North Dakota added public housing authorities, PHAs, in our North Dakota Century Code. It's actually kind of crazy. It created housing authorities in every county and every city in the state, but with some additional guidelines and criteria, each local jurisdiction had to pass a resolution. Long story short, today we have 32 public housing authorities and 5 tribally designated housing entities in North Dakota. Across the country, there are over 3,300 public housing authorities. Next slide. So what do housing authorities do today? Snagging from the HUD website, public housing was established to provide decent and safe rental housing assistance for eligible low-income families, elderly, people with disabilities, etc. Public housing comes in all forms and sizes, whether it's scattered site family houses to high-rise apartments, and in a variety of manners. So there's your public housing that is most commonly thought of, but there's also tenant-based housing, project-based housing, and some home ownership programs as well with single-family housing. And I should have a disclaimer here that not all housing options are available at every housing authority. And additionally, that each housing authority has the ability to create policies and procedures that meet their community needs, so long as they follow, federal HUD guidelines. So some of your different housing authorities might have different eligibility criteria. So along with that, I would say that unfortunately, housing assistance isn't an entitlement benefit. So unlike Medicaid or some of the other benefits our country has, if you are eligible for housing, that doesn't necessarily mean you are going to get housing. Yes, so with tenant-based housing, the Housing Choice Voucher Program is what you're probably most familiar with. It's also called Section 8, and that is our government's largest program for housing assistance. For Housing Choice Vouchers, you need to have 50% or less of area median income. That's something that during the application process, your housing authority collects information to verify your income, assets, all that good stuff. And it allows for the housing authority to ensure that they're being compliant with federal funding. There are also mainstream vouchers, emergency housing vouchers that are also participation with the coordinated entry system, VASH vouchers, the FUP vouchers, and then Housing Choice Vouchers also have a home ownership option. And I believe Grand Forks is the only one in the state that has the home ownership piece, but regardless. So with a Housing Choice Voucher, the voucher is the subsidy, and it's paid directly to the landlord on behalf of that family. And then based on their income, they are also required to pay a portion of their income towards their rent.
So Katie Jo, sorry, I can't see anybody because I'm presenting now too, but how does somebody get one of these vouchers with most housing authorities?
Yeah, so each housing authority's application process looks a little bit different. So going to your local housing authority's website or showing up at their office would be their best bet. A lot of them are offered online, but should still be in paper format as well. So when you go there, somebody should be able to help you determine which programs you want to apply for.
Okay, thank you.
Yes. And yes. So project-based housing is more so related to the units actually have the housing assistance tied to them rather than the family having choice in where they go and live out in the community. So there are, again, a lot of options there. So similar to the Housing Choice Voucher piece, or any voucher, I should say, you would go to your housing authority to apply for these programs. When it comes to the permanent supportive housing piece, that's where we kind of connect here with coordinated entry and the continuum of care. There are a few places that are similar for permanent supportive housing: Cooper House, Edwinton Place, and then LaGrave on First. And like Chanel said, PSH by HUD standards is for people experiencing chronic homelessness. So LaGrave on First and such, we use housing first, meaning that we've essentially removed any of the other barriers other than income eligibility, and then the two federal requirements for producing meth in a federally assisted unit or being a lifetime registered sex offender. Outside of those, as long as you are eligible income-wise, you move into our unit. So when a unit becomes available at LaGrave on First, our property manager, we notify the priority list manager, which is now Shanna or Chanel, and request a referral. For our units at LaGrave on First, we're saying that we're specifying we need an individual who meets the criteria for permanent supportive housing and is experiencing chronic homelessness. We receive that client ID for the next person within HMIS. And so we are utilizing that database to confidentially see who the next person who's highest in need of permanent supportive housing is. And we're connecting with that person as well as the individual who did the assessment, who did that housing prioritization assessment. And then once we are able to connect with them, same thing for the eligibility criteria. We're going through their income, assets, all that good stuff. I think one thing that's interesting or different, a caveat for LaGrave on First, and I do believe this means for Edwinton Place as well, but we actually don't receive COC funds for LaGrave on First. We opted to participate in the coordinated entry system because when we went to conferences and learned about best practices for housing first and permanent supportive housing, et cetera, it was well known that participating in coordinated entry was the way to get individuals who are experiencing chronic homelessness into those units. So
thank you. Yeah, that's great, Katie Jo. So, some of the things I just wanted, this is like a really good time to bring this up, but some of the things I've heard from other people, like kind of some of those myths that we have to dispel too, is somebody will say, my client has a felony, so I'm not going to go get him entered into HMIS, or I'm not going to go to an access site, or I'm not going to have an assessment done. He's homeless, but he's got a felony. And so can you talk a little bit about that? I could have brought that up earlier, but I just thought of it.
Nope, that's okay. If actually we sneak to the next one, we'll talk about eligibility criteria.
Oh, thanks. It's on the next slide after that,
Yep.
I think, too.
Yeah, but for eligibility criteria, so, income requirements, they vary based on the county that you're in. This is something that we don't by any means expect non-housing providers to know off the bat or off the top of their head, but you can look it up on HUD's website if you so choose. Otherwise, your housing authority would have that information readily available. If you want to go to the next one. We just talked about, so eligibility, what I was referencing earlier is there are only 2 absolute mandatory denials other than income. And so those who produce methamphetamine in a federally subsidized unit and those who are subject to lifetime registered sex offenders. We will not be able to provide housing assistance through like the HUD PHA programs. Earlier, I also mentioned that each housing authority has the ability to establish their own, eligibility criteria on top of that. That's something that HUD allows PHAs to do. And so more often than not, if there's debt owed, recent criminal activity or termination from housing assistance in the past could be a reason, but those are not requirements. So one thing I should mention here, it's really important. Each PHA has the ability to change their eligibility criteria. They have their admin plans, and that's something that they post on their website, in the newspaper, etc. And they do look for feedback on them, and that's an opportunity for service providers to, say, hey, we have a lot of folks in the community that are in need of a housing assistance, but the barriers to receiving it through this PHA are A, B, and C. So those are ways to help encourage and work with your housing authority to lower some of those barriers.
And there's also an appeal process, correct?
Yes. So it, again, can look different at each housing authority, but if there is a denial in housing assistance, there's an option or an opportunity for an informal review. And so that's for the individual who's seeking, or the individual or family who's seeking housing assistance. If they are working with a case manager or a support provider of some sort, they have the opportunity to meet with the housing authority and review their file. And, if things have changed or if there were extenuating circumstances, et cetera, their eligibility determination may be changed. But it is not a guarantee, of course. Yeah.
The other thing I wanted to highlight on this slide too, Katie Jo, was like social security cards, IDs. Is there any capacity within HMIS if you're with a person and they have those IDs, and we know that sometimes they can lose them, or, when you're not being housed, it's often, hard to keep track of some of those personal belongings. Are those are those able to be uploaded at all into HMIS?
Yes, they are.
And does that like help speed up the process if they get
Yes.
housing as well, correct?
Yes, there's also an opportunity for if you are working with folks that are experiencing or at risk of homelessness and you're utilizing HMIS, you have the ability to enter in what's called like the history of homelessness. And so when we talk about documentation and things of that nature, being able to verify that individuals have experienced long-term or chronic homelessness can be very important for COC funded projects in particular, of course. But generally speaking, we need to be able to ensure that funding is going to those who are most in need and fit those eligibility criteria for those related programs. So yes, there is the ability to keep that in HMIS, and it's super duper helpful because, well, especially with LaGrave One First, but everybody is housing ready, right? But there is a point of document ready, and that is something that if we aren't able to confirm and verify who a person is or what their income is or is not, et cetera, we are not able to move forward with moving them into a housing opportunity. Very important stuff. Okay. Then yes, continuing on, this is just highlights really of what you can expect for rent calculation. This is high level view stuff, just for people to remember that it's 30% of their gross monthly income. There are other things that are taken into consideration, such as medical expenses. There are different deductions that may be met. Yes, annual recertification. So every year, we need to make sure that people are still meeting criteria. It's truly reviewing most of the things that you already did during your initial eligibility. And then interim recertification, those are only needed, as needed. But there is an important note of for households that have zero income, you can receive housing assistance with zero income, but if you begin to receive income, you need to have an interim recertification done. Whereas if you're already employed, but you are now getting a raise or are getting a promotion, that doesn't necessarily have to be done until the annual. So yeah. I feel like the last thing I'd want to say is your housing authority can, could, should, would, all the things, they should be your friend. We want to work with providers. It makes our jobs, I'm not a housing provider myself, but it sure shit makes their life easier when they have somebody that they can work with. We have a lot of mutual clients, and one of my boss's favorite sayings is, we didn't get into the business of making people homeless. We want to keep them housed. So working together usually makes that a lot easier. That's all I got.
Thank you so much, Katie Jo. There were some questions, and I think thanks, David, for chiming in there too, and talking about like how there's those separate policies for each housing authority. I do think one thing we haven't highlighted yet, even though, is even when a person is, say they're homeless and they go into an access site or an assessment site and they have that assessment done, they can opt in for a housing site not in the city they're currently living in. So if they have a lot of, felonies or something that's barriers, but they're homeless and they're chronically homeless, they're likely going to qualify for permanent supportive housing in North Dakota, which are, low barrier admission. So, criminal history other than those two that Katie Jo highlighted on that slide, that can help with some of those things. But I would encourage you, like when you're running across like those difficult, people that appear difficult to house too, is, get some resource emails started. You know, I've reached out to Chanel on things. I've reached out to Katie Jo on things. I'm like, what am I missing? You know, how can I help this person get connected? And we've had really good luck that way too. And you know, there's not always answers for everybody, but we can continue to make improvements in our housing services in North Dakota if we keep collecting data, showing effectiveness, and doing all those things that we've been highlighting. And I don't know, is there anybody from the DOCR on the call today? Because they're very actively involved as well on a lot of, you know, some housing initiatives, and there's other things happening across the state that I don't feel like I can, you know, speak to them quite yet. But some of the needs that you guys are talking about in the chat, those have clearly been identified by others in the state as well, and there's some work groups. Well, thank you. Well, we've kind of went, you know, state, federal, and now we've gone kind of local and talking through the housing authorities. Now we kind of like to get a little bit on a smaller scale. And Kayla and Jenna, they offered to do a presentation on their local homeless coalition. And so with that, one of you guys can take it away, and we will leave time for some questions at the end.
And I think it's loading.
We can see it, Kayla. Mm-hmm.
Got it.
Mm-hmm.
Oh, kind of small, but I'm just going to go with it if that's okay with everyone.
Looks good.
My name is Kayla Hostetler. I'm the social services manager at Spectra Health. Spectra Health is a federally qualified health center. We have clinics in Grand Forks and Larimore, North Dakota. As part of my role at Spectra, I serve as the chair of CANA, which is the Community Agency Networking Association. I'll just refer to it as CANA from here on out, but there's a lot of alphabet soup in the world of housing, healthcare services, DOCR. So if we do use acronyms that you're not familiar with, put it in the chat or just interrupt us if you have questions. We're just going to talk a little bit about what the coalition and coordinated entry looks like in Grand Forks and why we care and get involved in this work. There's been a lot of information, great information presented, but I think Jen and I's hope is to get you interested in joining your local coalition because ultimately it's going to help your clients. I'll let Jenna introduce herself and then we'll move along.
Hi, my name is Jenna Richardson. I am a social worker with the Fargo VA. I am based out of Grand Forks, however, and for about the last year and a half, I have been the chair of our CARES group, and that is the Coordinated Access Referral Entry and Stabilization System in our state, which is a lot of what Chanel had spent the first 45 minutes or so talking about. So I'll walk you a little bit through how the process for CARES works in Grand Forks and all the work that we've done, especially in the last 2 years, to get it to be where it is.
Just for some context, the Jenna works for the VA, but because of short notice, we couldn't get approval for their logo to be on the PowerPoint, but she is equally, and the VA are equally at work in the presentation and the work we do in the community. Are you all seeing like all of our notes and whatnot too?
No, we can only see your slides.
Oh, lovely. Okay, perfect.
Mm-hmm.
Great. Sorry for the awkward pauses. I was making sure you couldn't see all of my notes. So just some quick overview of CANA. CANA has existed in the Grand Forks region for years in some capacity. It started as more of a networking organization where service providers would get together and share resources and information. In 2015, another group called the Region 4 Supportive Housing Collaborative started some work specific to housing development. And CANA stands for the Community Agency Networking Association. And in 2015, they really started ramping up development of a permanent supportive housing project that was Housing First focused. That has evolved into what is now LaGrave on First, which is the first Housing First permanent supportive housing project in the Grand Forks region. As that project started to develop, there was a huge community regional push for coordinated entry. As Katie Jo mentioned, LaGrave on First really prioritized making sure coordinated entry was utilized for filling those units, because coordinated entry is evidence-based, it's trauma-informed, it's might be a pain in the butt for service providers because it's a maybe different process than we're used to, but it's what works best for getting the right clients into the right housing options as quickly as possible. So we wanted to make sure we filled that unit with the people that were appropriate to be there. So in that time, we met almost weekly as different service providers to really iron out what coordinated entry looked like in our region. It was not pretty, it was clunky, and we all had a lot of growing pains and a lot of tough conversations, but we had to figure out how to make something work. And we did figure out how to make something work, and we're able to use coordinated entry to fill those units. And LaGrave on First opened in 2018. And I think, if I'm not mistaken or remembering correctly, they filled all their units within a month or two of being open.
That is correct. Within 3 months.
Within 3 months. So within 3 months, we were able to get 42 people off the streets who had previously been experiencing chronic homelessness. So coordinated entry works. And just a little bit of context for why maybe Spectra Health as a healthcare focused entity is so involved in housing. I have a housing background prior to coming here, and we really believe that housing is healthcare, and made friends with housing providers and other service providers so that we could best connect our patients to services. It's really hard to manage chronic healthcare conditions if you're experiencing homelessness. So all of this works together. And we partnered with the Housing Authority in that SAMHSA grant that Katie Jo mentioned earlier. So we have a couple of positions focused on working with people experiencing homelessness, and that has kept us involved in the coordinated entry process and our coalition work, in making sure that we're addressing the housing needs of our community just as quickly as we are their healthcare needs. So we've done all this work as a community, and then in 2021, CANA, who had been meeting, like I said, for years, officially adopted in their bylaws to act as the Region 4 Homeless Coalition. At that same time, established that CARES, which is the coordinated entry process, and outreach. There was essentially groups of us meeting regularly, a lot of the same faces at the table, a lot of the same topics being discussed, a lot of the same issues being presented. And we really just decided, let's figure out how we can consolidate meetings, make the most of everyone's time, energy, and efforts. So now CANA serves as the regional coalition, and our outreach committee and CARES are committees underneath the CANA umbrella. And CANA meets monthly, and CARES meets directly after the CANA meeting. We actually use the exact same link to try to make it easy for people to get into both meetings. And there's pretty broad membership for our regional homeless coalition. We have everyone from Head Start to the public schools to job service to our regional homeless shelter, VA, and kind of everywhere in between. So CANA is pretty intentionally broad, and we share resources, information, have speakers come and talk about new services in the community. And then CARES is more specific, and that group, in order to participate in that group, you have to have, as Chanel mentioned, a signed CARES agreement with the COC, because that allows for some data sharing information, and then we can actually staff clients that we might be struggling with and get down to the nitty gritty of what coordinated entry looks like and what clients are experiencing in our community when they try to enter into the homeless management process. We have a pretty robust, that also kind of combining it also allows us to have a pretty robust distribution group. So you can send a lot of information just to CANA, and I can send it out to everyone, and that includes everyone involved in the Homeless Coalition, coordinated entry, outreach. It goes to everyone. And that hopefully eliminates you getting it from 12 different places or from other people not getting it at all. So we have one email that CANA uses, and we distribute materials through that email. That's there. So you're welcome to send us questions or information there. And then because CANA does have a membership process and there's a fee associated with becoming a part of CANA, that does allow us some funds to do some actual work. So we've done various outreach projects, events, and put together some survival kits for people experiencing unsheltered homelessness, and the membership fees for CANA has supported those work to hopefully actually improve the lives of folks actually experiencing homelessness. I'm gonna let Jenna take it from here.
Okay, so this is something that we in Grand Forks have developed over the last, I would probably say 2.5, 3 years or so, but this is our coordinated entry workflow. Basically, this is how coordinated entry looks like in our community as of today. So we basically, if you were an individual experiencing homelessness, you're most likely going to first encounter the system through an outreach worker. And so we have several outreach workers through various agencies like Spectra Health, PATH. We have strong relationships with the police department, our veteran services, the mission, and then we also have our SAMHSA and YHDP outreach folks. So from that point, you would then be referred to an access site, which we have 3 access sites identified in Grand Forks at this time. So at this point in the process, you would be, what would happen is you would have an assessment done to determine what is most appropriate for you immediately in that moment. So if you can be diverted from the shelter by being provided rapid rehousing type of assistance just to help you get into a new apartment, that could be available to you. If you're not able to self-resolve, you would be channeled into a shelter setting at that point. And then after about 14 days, which is usually the suggestion, I think this is something that we have yet to work on. You would be administered the housing prioritization tool if you are unable to resolve in that first 2 weeks. And then we have several different assessment sites. Unfortunately, I can't make it larger, but we can get you guys the PowerPoints. As far as assessment sites, we have Spectra Health, we have CVIC, which again, they're domestic violence only, Grand Forks Housing Authority, United Way, Red River Valley Community Action, and I believe we did just receive some signed agreements for Community Options as an assessment site, so I'm assuming they are going to be working on that as well. Following the housing prioritization tool, they are then referred to the appropriate level of housing intervention, which ranges from low need to high risk need. And then we have our housing options. So we have LaGrave on first, we have rapid rehousing dollars, we have our emergency housing vouchers that were as a result of the COVID funding. Let's see here, Prairie Harvest Mental Health has some units that are available. Red River Valley Community Action has some available. And that's really where we're at from an overhead view. Generally, what we are struggling with in our community is our access sites. We're still waiting on our diversion and triage tool to be produced, but that should be happening in the coming months. So really our access sites are struggling because what's happening is you present to an access site or you don't, you're getting right directly into this housing prioritization tool. So we're missing out on a lot of that diversion that would be likely save a lot of people from having to enter into shelter in the first place. On the sides here, if you notice these yellow boxes, we also have agencies that are known as stabilization providers and auxiliary service providers. So auxiliary service providers are service providers in the community that are involved in coordinated entry, have a CARES agreement, but they aren't necessarily using HMIS. With stabilization, these are a lot of the agencies that you're going to see that are probably more intensively working with the individuals that are flowing through this system. And so we have several agencies that do that. But yeah, that's really what it looks like here in Grand Forks. And I will say that from the first, I know that Kayla and I created the first workflow that we had for Grand Forks. And this is a far cry from the first one that we made. So it has definitely taken a lot of time and taken a lot of intentional work. But I think we're doing a whole lot better than where we were sitting about 3 to 4 years ago when I first started doing this work. But yeah, that's kind of where we're at. And every community is going to look a little bit different because you'll have different resources. Your homeless population is going to look a little bit different. So it's probably not going to look exactly like this workflow, but I mean, as the access site into the diversion and triage, into the HPT, into your housing options is really kind of the skin and bones of the workflow.
There's a question in the chat. If there's a timeline once the person completes the housing assessment for getting approved for housing, or for someone to respond, or if they would lose their spot, or they need to reapply. Chanel, do you maybe want to?
That's probably the prioritization list question. I can talk about it too. I don't know. I don't see Chanel.
I'm here.
Cool.
So it really kind of depends. They can be on the list a long time. Right now, our average time on the list is 180 days. Now we're trying to do a lot of cleanup with that to, we allow people to be on the list for 6 months. If they haven't had any contact with the assessing agency or their case manager, and they've kind of disappeared, then we will remove them from the list and ask that they be reassessed when they reappear. But it all depends on the housing providers and how long they're going to sit on that list before a referral is made. Now, I'll say that people that have that higher need of housing might be housed quicker than somebody, obviously, that has a low, that comes out on that vulnerability prioritization as a low. The time on the list really just depends. It depends on available housing. It depends on whether or not the people can be contacted. The housing providers do have 2 weeks, and by our prioritization policy, they're required to attempt to contact the household 3 times before we can close that referral. Does that answer your question, Shay?
I think it's important to specify that this whole workflow is completely separate from the idea of applying for like Section 8 assistance in public housing. That is something that happens within this workflow. This isn't the process for accessing Section 8 or public housing. That is something directly through your housing authority. This is for the, like I said, the rapid rehousing dollars, which can help you get into an apartment. These are the permanent supportive housing units. These are specific units that are CLC funded that are for people more intensively experiencing homelessness.
Thank you for highlighting that too, Jenna. I think that's really important.
Oh,
sorry, Kayla.
Sorry, here's Jen and I's contact information. We love to be friends with folks, so if you have questions, reach out to us. I think I'll give time to Heather too, but I think what we really wanted to emphasize was to get to know your community service providers, get to know your housing providers, make friends with the people in your community, because they are the people that are going to help you connect your clients. If you didn't know what any of this meant, talk to the people in your housing authority and get to know them, because they will make life for your clients a lot easier, and get a little comfortable with being uncomfortable. We have to step outside of our worlds and in order to best help our clients, which is why I assume we're all here. So thanks for your time. I'll hand it back to you, Heather.
Thank you so much. Well, I wanted to kind of just highlight what Kayla mentioned there at the end, like get comfortable with being uncomfortable. You know, one thing that I've learned through learning to navigate, you know, housing resources and housing services is you have to get really comfortable at asking a lot of questions and trying to understand how the systems all interface with each other. And you know, and even in the chat, we said, I'm sorry, I asked a dumb question. Like, no question is a dumb question. And I mean that in housing. And it's like, we can't really help the people that we serve or that we come in contact with if we don't understand how to navigate these resources. And part of this is really like a call for action. And many of you have heard that from me, you know, through the years. But if you're not involved, you know, currently in your local homeless coalition, you know, get involved or have somebody from your agency getting involved and reporting back to your team so that your agency and the people that you're coming in contact with in your local community can get access to many of the services and supports and housing resources that we do have in North Dakota. And, you know, again, I don't want to be a broken record, but without the data, you know, you know, I think Kiri highlighted that with Western North Dakota. She said, it looks like we've resolved our housing issue in Western North Dakota, and that's not true. You know, I was chatting with somebody on this call during this meeting that there's I think she said about 80 people in one city in Western North Dakota that are experiencing homelessness. And so, but if we can't present that information or data to the federal government, we have a hard time securing those funds for those services and housing resources in North Dakota. So with that, we'll take some time for questions, if anybody has any. This was a really great group of people. I plan to run the attendance report and send you guys the PowerPoints with permission from the presenters. And then any contact info you need if you don't have it. I know Kayla just threw hers in the chat there. Some of you might lose the chat if you're not a North Dakota Teams user. So I'm going to try to save that chat and send that as well in the email. But if I have any difficulties and you guys really want something, just please email me, hbrandt@nd.gov. And then just plug, we have our next session coming up, which really meshes well with what we just talked about today on May 3rd. It's called Introduction to Housing First, and that's going to be Beth Olson, who will be presenting on that date and time. So please join us for that next session. Session 3 will be Introduction to Harm Reduction, which will be Jan Eliason and Leah Seward from the City of Fargo. And then session 4 is the housing resources. So if you have not yet reached out to me and you want to highlight resources within your agency on that June 7th webinar, please let me know that you want to share your information. And then lastly, and really importantly, session 5 is You Got Housing, Now What? You know, we kind of talk about this phenomenon that, you know, when you're a case manager, you're working with somebody in the community, get them housing, it's almost like, whoo, hard work's done. And, you know, we really want to change that narrative and start talking about, you know, that's really when the rubber meets the road, when we need to be ensuring that we understand how to work with property managers, that we are providing the correct supports to people, because we understand and know that it's much more harmful to communities and people when people lose their housing and end up in systems that are very expensive or at the shelter, and we end up having to rehouse them. And so our goal is really for people to retain and maintain housing. And so we're hoping that in session 5, you can help gain some of those skills, and then hearing from all of you around what are those continued needs, and building more sessions and series to bring these resources to you. And with that, I'll let you guys go. I'll just stay on if anybody needs anything, but thank you so much for your participation today.